All right, so this is a really good one. You're going to want to tag an ER nurse or an ICU nurse who's getting ultrasound trained, or new grad. They might be interested in getting this trained because ultrasound IV placements are going to be the future of nursing care. So we have two vessels here. We have one to the left, one to the right, maybe even a third vessel here, and something going on right there. So what I want you to pay attention to is this second layer or lining on the inside, present in this vessel but not in that vessel. Okay,
inability to distinguish between.
So this particular patient, I had a hard time differentiating the compressibility because when I applied my normal standard amount of pressure, both of them seemed to have collapsed. So the arteries were very weak in general, and so I needed to be more light, more gentle on the compression because the compressibility was more sensitive with these vessels.
Vein and artery, because the compressibility is equal for both. It's hard to tell which one's the artery, which one's the vein, because they both compress equally. So I'm going to be more light on the compression, more gentle on the compression, and then see which one pulsates. There we go. That one pulsates. The one on the left.
You guys see that right there?
And if it's hard to tell because of the movement, I want you to look at the double lining of the one on the left.
So that's how you tell the difference between an artery and a vein when you're looking at the ultrasound device. Okay, so you're looking for those characteristics: the thicker lining, the with super light pressure, less compressibility than the vein, but also the pulsation. So see if you can find a good one, good pulsating moment right there.
And here you see at this location of the arm, increased compressibility on the right side versus the left. They both kind of regurgitate. It's hard to tell sometimes, depending on the patient's spasm. Okay.
So this particular patient was difficult to tell because they were spasming and moving their arms a lot. They had no control over themselves, probably because they were confused or had other issues going on.
The left vessel. So there's a couple ways you can tell if it's very difficult to identify. See that? Do you see that extra 1 or 2 millimeters?
So right there, you can see the pulsatile behavior on that one versus this one. Both compressed about the same amount, but that one started to pulsate.
Extra lining.
Press that plus button for more tips and tricks.